Good morning, good afternoon, everybody. I would like to thank you for joining our master class on writing a compelling scientific abstract. I'm Dr. Jazieh. I'm the founder and CEO of the Innovative Healthcare Institute, editor-in-chief of the Global Journal on Quality and Safety in Healthcare, and the CEO of the Innovation, the chief scientific officer actually of the Innovation Journals, and work as an oncologist and director of innovation and research at the Cincinnati Cancer Advisors in Cincinnati, Ohio. So the Innovative Healthcare Institute mission is to improve the health and reduce disparities in healthcare by means of innovation, collaboration, and dissemination of knowledge. And as you see in this chart that, there are different activities we do to achieve these goals. Innovation through research and supporting innovators and researchers, creating networks for collaborations, and disseminating the knowledge through our publications of the journals, Innovation Express, and the annual events and summits and master classes and so on. So these are our 4 journals we have, innovation journals. You can find them at the website innovationsjournals.com. And if you have any question about publishing issues in these journals, you can write our editorial office, Valerie Clark at editor at innovationjournal.com. So the JIBO, first journal is JIBO, which is Journal of Immunotherapy and Precision Oncology. From its name, it focuses on publishing articles related to cancer, oncology field, and immunology. The editor-in-chief is Dr. Ang Neng from MD Anderson. He's professor of investigational cancer therapeutics, and there is a distinguished panel of editors from all over the globe. JQSH is a global journal on quality and safety in healthcare. I'm honored to be the editor-in-chief of the journal, and the associate editor is Dr. Khalid Al-Surimi. And then the third journal is IDDB, which is Innovation in Digital Health Diagnostics and Biomarkers. Again, the names are telling on the areas of interest of the journal. Basically, anything related to, digital health, telehealth, precision medicine, and so on will be of interest to the journal. We are fortunate to have editor-in-chief like Zaïs Kuzlakidis, who is the head of IARC laboratory in WHO in France, with associate editor of Daniel Catchpool. And the last journal is ISIM, Innovation in Surgery and Interventional Medicine, with Dr. Prof. Khalid Al-Qattan as editor-in-chief, with associate editor Azam Kankan. So, diving into our master class, the learning objective here is basically to learn best practices in writing and compelling scientific abstracts. So what are the best way to get this strong scientific abstract that, will impress the readers and the reviewers and get you in the meetings or in the publication platform. And the second thing is to get familiar with various components of the scientific abstracts. And then, we have a practice session. I don't know how we are going to do that, but we will try. I have done this master class multiple times in person. This is the first time I'm doing it virtual, but we will talk about, how can each one of you participate to get feedback and input in this master class. So, how you benefit the most from this masterclass? If any one of you has an abstract, already written draft, or you are planning to publish it, this will be good, opportunity for you to practice, to enhance your abstract and get it into a better shape. If you don't have an abstract, but you think of a project you already did and you would like to write it, to publish it, to share it with others, this also will be a good chance for you to start drafting your abstract. If you can put it in, write it in the computer, that's fine. So if you want to share with us questions or something, but even if you write it on a piece of paper, even, just, simple draft thoughts, ideas, what you want to put in the abstracts, it will give you a good mileage and good benefit from this masterclass. So you follow the instruction that provided in this masterclass as we are going to go through it. And then ask question in the QA panel. Please put the question in the QA panel. We will answer all the questions if possible. And then if not, we will either answer it live or we can answer it in writing if we did not get a chance to answer all the questions. And then, as I said earlier, please try to work on your abstract in the practice session. If you don't have an abstract, listen to the comments and feedback or input from others when we are doing the practice session. So, and how you could be ready to share your contribution. Let's say if we said, let's put your title into the abstract, you can put it in the QA question answer. And then if I get a chance to copy it and show it to people, and then we give you feedback on it, or we can just read your contribution to audience and then give feedback on it. And then for those who are watching the video recording later on, we'll be, by the way, recording the video and share it with you and share it with others. You can always show your work to others for feedback. For you who are watching now, and for anybody who is writing any paper or abstracts, involvement of the co-authors is essential, is a must, of course. And the earlier you get them involved in it, the better, so you can get earlier feedback on it. But you cannot submit an abstract with author's name without them approving the abstracts or the manuscript and giving you the okay to do so. So, excuse me. So this is what we'll cover today. What is an abstract and why do we write it? What do you need to do before you start writing the abstract? What types of abstracts are there? What are the abstract's components? We touch upon some ethical issues, and then we will talk about what are the reviewers and editors looking for. So linguistically, abstract is a noun. I mean, it's summary of a text, larger text, scientific articles, documents, speech. You have the highlight of that in a shorter version, which is the abstract. And it concentrates in itself the essential qualities of anything more extensive and larger content. For our purpose, what we are going to discuss today in the masterclass, the abstract is an executive summary of the essential components of a scientific work that you have done. So we are just focusing now on the scientific abstract writing. When you're writing abstract, there are goals. Of course, you have to, you have to know the purpose of the abstracts. Usually, the abstract is summary of a manuscript, thesis, dissertation, grant proposal, and it basically gives the readers a synopsis of the work that you have done and attract them to read more. So, and most of the time, most of the people write abstract to submit to scientific meetings, seeking an opportunity to share their work with a larger scientific body. And unfortunately, most people stop there. So a large number of people, actually the largest number of people who do scientific work do not even write an abstract. But then small number write an abstract, submit it to a meeting, and most of the time it's end up being just an abstract and they don't take it into a full manuscript. So that's why, now we are trying to overcome the first barrier, which is to write an abstract. And by the way, once you write an abstract, almost the most difficult work of writing the full manuscript is done, because when you are writing the abstract, you're supposed to have the most pertinent information to share with others, and therefore writing a paper will not be an issue at all. So So that's, our goal today is to get you all comfortable to write an abstract. And if you already wrote an abstract before, this is to enhance your skills and improve your ability to write better abstracts. So, of course, before you start your writing your abstract, you have to, think what is the abstract? What does the abstract mean? Very important to realize that the strength of any scientific abstract is related to the work done before, prior to that. So the abstract is the final result, the final fruits of hard work that is done before, which means you need to make sure that your research question and methods are well thought through. So that may not, by the way, change for things you have done already, because you cannot change the work done, but that's an important thought to keep in any future work you do, that is my work worth doing? Is it worth in the future? You think I can publish it, people will benefit from it, and so on. And what question I'm answering, what gap I'm closing, what problem I'm solving, and so on. So that's very important to ask upfront. So it will not help much this, for the current abstract, but it will help you tremendously for your future work. And for the research to be publishable, there should be a meaningful hypothesis, strong question, and then solid methodology, and then a reasonable, good, insightful interpretation of the result. And when you are writing the abstract, you need to think of the communication flow of information. You are the sender, you are sending a message, and there will be recipients who are your readers. So you have to have very clear message. What am I going to tell my readers? What is the message of my abstract? If I want to summarize it in 30 seconds and talk to somebody in the elevator about what I've done, what is that message? And then you make sure that your abstract goes around making this message clear to people. And then you need to know your audience, and what are you trying to get from them reading the article. So if you are writing executive summary to get grant, that will be different than abstract for publishing. That's different for a lay person abstracts, and so on. So you have to know what is the purpose and the target audience of your abstract. Now we will go over general tips. I will give you by the end of each session time for QA. So, we'll go through certain material, then we will stop. But meanwhile, please write any question you have on the QA so we can discuss it in the QA session. So, in very important to realize that abstract is a standalone work. It should tell a story by itself. So it's not just an introduction. So don't leave audience hanging, so it has, if somebody read your abstract, he has to get something out of it. So this is very critical. But very important, I can mention that later. In scientific meeting, the abstract is not enough by itself to give you the whole story. But nevertheless, when you have an abstract, people should understand exactly what you want to say in that particular abstract. And you should write it from scratch. Please do not copy and paste from the manuscript. People write the manuscript and then they copy the sentences from the manuscript and paste it in the abstract. So the conclusion is the same as the last line of the manuscript. It doesn't look good. It's not viewed favorably. And then it should be written last. So the last section to write is the abstract, and it's the first to read. And it's very important to make sure that you write it last. And of course, unless you are writing it to submit it as a standalone abstract, that's a different story. But if you are writing a manuscript, the abstract should be written the last, and it should be written, in a way that summarizes the pertinent information you are mentioning in your abstract. And you make sure that the reason why you need to write it the last, because sometimes you edit the results. The biostatistician give you different information later or additional information. You may change some of the number in the body of the article, and then you forget to fix it in the abstract. And there'll be some discrepancy between your abstract and your manuscript. But the bottom line, since the abstract is the synopsis of the manuscript, it should reflect the final version of the manuscript. And that's why you should write it in the end. So the abstract goal is to provide adequate information to aid in searching and indexing. So that's why you have to incorporate important keywords into the abstract. The purpose of publishing abstract is to share your knowledge with the largest number of people. And that's why you need to make sure that your abstract is captured with the search engines. And that's why you should help the search engines by giving specific keywords that easily searchable, and those who are looking for a subject that you are tackling in your abstract should be able to find your abstract. And that will help you in the citation, and more people reading your abstract, more people benefiting from it, and so on. And then the abstract, of course, should summarize all key information. You cannot put everything in the abstract, of course, it will become manuscript. But that's why you have to say in each section, what are the most essential thing I want people to read? I want people to know about my work. And then what you do then, the most important thing before you start the abstract writing, and in the end before you submit it, to follow the journal instruction or the scientific meeting instruction. If they told you the word limit is 250 words, or the characters number is 2,000 characters with space, without space, please conform with that. If they told you are allowed to put one table, you put one table. They give you one table and one table or one. You read everything clearly. If they told you one table or one figure, that means either one of them, not table and figure. Because in many of the meetings that I have run in the past, people submit 3-4 pages as an abstract. It likes almost mini paper, or they put 3-4 tables, and we have to reject it. And some of the meeting, if the template does not lock you, so if you are some of the templates, if they say 300 words, if you wrote 301, it will not allow you to submit. But some of the templates may not be as smart, and then they let you write. But when they come to publishing, they truncate your article at 300. So it doesn't, or your manuscript or your abstract. So it doesn't look good that they truncated your conclusion. So just stick with the instruction. And that's if they may refuse it even. So if somebody violated the instruction, they may turn it away and reject it. And it will be, after all the efforts you put and so on, it will not be good that your abstract will be rejected because you did not read the instruction. Do they want it structured abstract or not structured abstract? And we'll mention that briefly later on, and we'll show you different examples. So these are the things you have to pay attention to them when you are writing an abstract. So what types of abstracts out there? So there is the scientific abstract. There's plain language summary. There are video abstracts. Now, many of the journals are asking people to do, authors to do video abstracts. And then, of course, there is visual abstracts, like infographic, or, what you do for posters. Actually, the poster is a little bit more of extensive abstract, if you will. In many of the meetings, they accept the abstracts in either poster format or oral presentation format. And we are going to focus in this master class on the scientific abstract part. So we'll just focus on that one. We are not going to touch upon the other ones. So if you look at this one is unstructured abstract. You don't see subheading. You don't see background, methods, and so on. It's just sentences flowing without, sections or separation. This is, this unstructured abstract, and there are many journal requests that. It's no subheading. It's a single paragraph, and usually summarize what the paper is about with less detail than the structured abstract. So here, they are not telling you the result. They tell you this review tackles the rapidly growing body of evidence evaluating the relationship between the guts, microbiome, and so on. Additionally, this review, so this is a review article. There's no result. They are just telling you what they are going to discuss in the article. And that's why there is a use for the unstructured abstract if it was not structured research abstract, if it's review article, sometimes case reports, sometimes, so they may tell you, it may be, and some of the journal, based on the article type will tell you whether you want to do structured abstract or unstructured abstract. Well, if you look at this one, it's a structured abstract. So, you see here the background, you see methods, results, conclusions. So this is a structured abstract, by specific section, and each section should have clear information that is related to that particular section. And this is what we'll be discussing today, these components of the abstracts, from the title, the co-authors, then these components, and then briefly we'll mention the keywords. We talked about it briefly earlier. So we will have also 3 case studies, just in case, and if anybody want to share some of his work, we'll be happy to accommodate that. So the first case study will be from IDDB, so the use of mobile health platform for remote assessment of suicidal ideation, depression, and anxiety. And this will be color-coded by blue. And then GIBO article, safety of immune checkpoint blockade in patients with cancer and pre-existing autoimmune disease. It will be green color. And then quality improvement projects, improving door to antibiotics administration time. And it will be in orange color. And I intentionally selected 3 types of articles. One, innovation technology, one is oncology, which is mid-clinical, and one quality improvement. There is some certain characteristic different in each one of them that we can pay attention to. So these are the essential components of the abstract. The title should reflect the research questions and or the findings of the study. Again, I'm giving you general kind of information. Some of the journals don't like to have the result in it because it may be misleading. They may not agree with your conclusion and so on. Quality improvement papers, they want you to say something dynamic, and they may want to see the outcome. And I'll show you the examples. So the title, then the background / introduction. Then there is methods, some abstracts say methodology / patients. Then results, then conclusions, and then the keywords that signals basically to the search engine that here we are, look at us. What I'd like you to think of it in a very simple way. There's a story here. It has to be connected. In the background, you say, what do you want? What do you want to do? What do you want to do? And of course, you can justify why. Why do you want to do it? What is the problem you are addressing? But what do you want to do? And then how do you want to do it? And then what did you find? And then after all this hard work and you did research and so on, and you have a result, so what? What does this result mean? What is the take-home message? So what did you do? How did you do it? And what did you find? And so what? What does that mean? And the so what has to be connected. You have to answer the question that you set to do. So you have to close the loop. You will not say that you were looking for apple. Oh, by the way, and you got oranges. You have to say, and if you did not get the same result, you say our study failed, or could not reveal the same. So you say it clearly. You have somehow to connect it, and if you find something interested, you add it later. But you have to close the loop with the goal that you set in the beginning. Okay, so let's start with the study title. The study title is really very important. To select the title, is critical thing. That's why you find in the magazines and the journals, in marketing thing, you have people who are specialized in just the titles, how to write catchy titles, what fonts, what color, what so on. Of course, in scientific articles and abstracts, you don't have this, and you should not do that. The journal has certain format, and how they are going to have the title there, but you should try to work on selecting the wording of the title in a very good way, because it either attracts the attention of readers or repel them and make them lose interest and not continue reading your abstract. So a good title is short and concise. You don't want people to sleep in the middle of your title because it's half a page. It's easy to understand and gives the readers accurate data, accurate ideas about the study design and the outcomes. Should not be misleading, should not be over exaggerating things, and it should have keywords that are easy for search engines to catch, as I mentioned earlier. So these are our study examples. And again, if anybody wants to put a title of his abstracts, I'll be happy to copy it and show it to people and then discuss it. So the first example, use of a mobile health, mHealth. Some, by the way, journals accept to put abbreviation in the title, some they don't. But nevertheless, you have to look at the instruction. Use of a mobile health platform for remote assessment of suicidal ideation, depression, and anxiety. A longitudinal retrospective study. So they tell you what they are looking for, what are they using, and then the type of study they have. That's an example. So even if you are interested in suicide, you'll find it. If you are interested in depression, if you are interested in mobile health, you can capture this article. So the second article, quality improvement, improving door to antibiotics administration time in patients with fever and suspected chemotherapy-induced neutropenia, a tertiary care center experience. And then, so there's here improving. So there is actually telling you the result. It's already improved, mean they achieve something. The previous one, it doesn't tell you the result. It tells you the study type and what they did. This one, it tells you, because quality improvement, they want to see these things. Improving door to antibiotics. So they tell you already their projects achieved that. And then here, safety of immune checkpoint blockade in patients with cancer and pre-existing autoimmune disease and chronic inflammatory disorder. This is a very important topic in oncology. Immune checkpoint inhibitor is hot topic. There's a word cancer, there is autoimmune disease. This is also a challenging thing in oncology. So they are from the title, that this is a topic important for those clinicians who are handling the patient, and then they will be interested to read the article. So it goes with the title. If you notice the previous, in every journal you find the title, and then there will be authors affiliation, corresponding author should be clear, and then they ask you for disclosure from all authors. All authors now, even in abstract, by the way, submission to meeting, all authors has to disclose their conflict of interest. So criteria of authorship, this is a very tricky subject, especially in different countries and so on, because there's a lot of issues goes and dynamic in each department and so on, who to include in the authorship and the sequence of authors and so on. But, you know, in ethical way, these are the criteria to include authors. Authors should have, you know, to be co-author, you should have, you know, contributed to the concept development. So if I sat with you and I brainstorm with you, I say, should I do that? You know, should I use this form or that form? Should I use this question or that question? Which patient I should do? Then you show me the results and I help you interpret the data and explain. That's, you know, very important. So I should help in the concept design or interpreting the data and so on. And then I should be editing your manuscript or the abstract. And I should be approving the final abstract. You know, you send me the final abstract, I say, yes, that's fine with me. And the most important thing is now to be responsible for all aspects of the work. So, you know, whenever you are published and your name is on the abstract, you are responsible on the content, even if you are not the first author. So you have to, you know, you cannot say, oh, I was not involved in that, you know, they did it and I was not aware of the data. It doesn't matter. Your name is on the abstract. You have to claim the full responsibility of what is written in that article. So, and you cannot say, oh, I was not aware, or I did not have access to the data. If you don't have access to the data, if you don't know what's going on, don't accept to put your name on the article or on the paper. And many times I refuse to put my name on things that I was not comfortable with. And you know, so it's not just, you know, getting your name on the paper. You have to be comfortable and responsible of what is published and your name is used for. So these are, and there is, of course, the website, you know, for icmge.org, and you can look at the authors and contributors and so on. Now, if somebody helped you in a certain way, let's say you give me the article and I read it and I edit it for you. That's not enough, by the way. Editing the article is not enough to be co-author, but you can acknowledge me. You can say, I would like to thank Dr. Jazieh for his editorial feedback. Your secretary, somebody helped write the article, the department secretary helped write the article and so on. I mean, type the article. You can say, I would like to thank our so-and-so for her secretarial support. Somebody collected the data, a technician, nurse, somebody, but just collected the data, not contributed. You need to thank them, and you put that in the acknowledgement. So here's the acknowledgement. So someone who helped, but not at the co-author level. So you put that. You disclose any funding, source of funding that support the work, and what are the type of organization and so on. And you disclose the conflict of interest, especially those are related to the work. So some journals ask you to disclose any relation that may impact that work. And some of them now asking you to disclose all your relations with the sponsors, with pharma, even if some of them, if your family member, spouse, or something has relation, you may have to disclose it too. So it depends on how strict the journals and the scientific society in that. So, and many times they will not even process the article till they have the disclosure from every author or co-author completed and signed, and then they will process. They will not send it to the reviewers, you know, till they have everything about conflict of interest. So you know, bottom line, you have to adhere to the instruction from the journals. So and we said here, why did you do the projects and what did you aim to do? So what did you want to do here? So the introduction should include problem description if you can, and then objectives and specific aims. If the introduction or short by the journal requirement, or the number of words are too many, you cut the problem and you just state your specific aim. You should not miss your specific aims. What are you doing? So people right away when they read it, they know what you want to achieve from this. And it's usually 2 sentences, not more than that. So 1 sentence will be the problem and 1 sentence will be the aim. Some journals will split the objectives from the introduction, and so it's okay to, the most important thing is that when you finish, before you move to the methodology, you should have the specific aims stated clearly. Okay, so let's do these examples, and that's why I put these examples actually, so because it's virtual and I did not expect participants to share their own work. Usually what we do, we show example quickly and then we hear from the attendees. So look at this one, the first example. They state the problem. There is a growing support of the use of integrated measurement-based care to capture symptoms data on real time, so treatment providers can make informed decision about intervention strategy for mental health, such as depression, both of which are known to increase suicide. So this is the background, the problem. And then they said, we examine, so this is their goal. We examined, and they put it in the past tense, by the way, because this is already done, the potential scalability and effectiveness of mobile health application with integrated behavioral health functions to capture remote patient supported. Okay, so this is what they did. Now, the second one, they stated the problem that chemotherapy-induced febrile neutropenia is a major cause of morbidity and mortality in cancer patients if not treated promptly. And the problem is, facing considerable delay in the management of chemotherapy-induced febrile neutropenia in our emergency department. So that's the problem. We initiated improving projects aiming, so this is the word aiming, for door to antibiotic time of 60 minutes or less for all patients with fever and suspected chemotherapy. So this is the problem and this is the aim. Now, this one, they said the checkpoint blockade therapy is immune therapy blockade that is helpful in cancer patients. However, their complication may be worse in patients with autoimmune disease. So they put the aim separately here. The aim of the study is to evaluate the safety of immune checkpoint inhibitor on cancer patients with very existing autoimmune disease and or eczema at the institution. So you see the pattern here: problem, what they're doing, problem, aim of projects, and so on. And that's the background. It should be simple, 2 sentences. If you look at them, it looks like long sentences, but it's 2 sentences generally. And if word count is a problem for you, you can always cut down something in the background. And whatever you do, never miss your aim of the study. So, okay, we'll move on to the next section, which is the methodology. So the method is basically, what did you do? So in this section, and this should be the easiest part because you already thought about it and it's writing it. Actually, many people say, just write this, if you have a protocol, just copy the protocol methodology and put it and edit it to become a paper. Because, this is the easiest part. The background also should be easy because you already, before you do the research project, you should know what is the background and what is your goal. And the section, the method section, is describe what you have done specifically. In the manuscript, the method should have enough detail for somebody to reproduce the work. But in the abstract, you should just mention the pertinent information because you don't have a room to describe the methods in a lot of details. So you just give hints about the most pertinent thing that people need to know. And if somebody is interested in the abstract, in the subject, then he goes read the methodology in more details. So it should have, the data source, for example, and endpoints and outcome and what the methods of analysis you use. 2-3 sentences usually. Of course, you cannot change the methods at this point, and that's why it's important to invest time in it upfront. And it should be easy to do, as I mentioned. I have seen repeatedly that people put the results in the methods. Do not mix it. Do not mix it. Just mention the methodology without referring to the result in this section. Okay, so these are some of the components. You don't have to include all of them. It will be too long, but these are some of the components you put: the context, setting, study design, which should be probably in all of them. What is the study? Is it retrospective, prospective, clinical, randomized? This should be included. What type of intervention you have done, measures, endpoints, and how did you do the data analysis? So these are the examples. So you look at this, they said the study, the first one, the study was observational retrospective review. So tells you the methodology of de-identified patient data, including symptoms of suicidal ideation, depression, and anxiety, as measured by patients' health questionnaire. So they give you the source of the data, and they give you the tool they used, or generalized anxiety disorder 7. So they give you the tools they used, which was administered to be and completed by patients on the smartphone. So this is the methods, desktop application, after controlling for age, sex, and the presence of moderate versus severe symptoms at baseline. Mean scores were analyzed with the students' t-test. So they tell you how did they analyze it and what did they control for. So, and then the second example is a multidisciplinary team was established to work on the project. So this is, the setting and the team description. We use the quality improvement tools for mapping of the existing patient flow process. So this is process mapping, a quality improvement process. Several proposed change ideas have been tested using the model of improvement. The change ideas included improving the triaging processing, creating an electronic chemotherapy alert caution, and order sets for physician, and using the hotline by nurses to call the pharmacy to expedite the process of preparing of antibiotics. Outcome and process measures were collected weekly, and they were discussed thoroughly and analyzed. Run charts were used to monitor the progress. So they are describing different things, wording that are related to quality improvement. So they mentioned the teams, the process they use, the tools they present the result, and so on. But they did not mention the result at all. So they just what they have done, and so on. And then the third one, I don't have to read all of them, but you can see this is retrospective study where it's done for date, from which date to which date, and so on. Okay, so these are examples. So now we'll move to the results section. This is where all your hard work has to show here, and then you have to present it in a very balanced but appealing way. So here, what did you find? In this section, the authors tried to show the outcome of their study in the most accurate and comprehensible yet concise way in the abstract. So it should be limited to the key finding of the study, especially those related to the objective. So please always connect your methods to the objective, your results to the objective, and then the conclusion to the objective of the study. So if you look here, so the result here, they're saying, let me read the second one since I read the, so here, after 6 plan, do, study, act cycles, all process measures improved, all the process measure improved. And ultimately, the door to antibiotics time was achieved by reducing it from 255 minutes to 49 minutes. So that's what they set up front, the aim, to go below 60 minutes from door to antibiotics So they are telling you that they achieved the goal. During project testing and implementation, the nurse staff skills improvement and education were taken into consideration as a balancing measure. So now they added something else, but the most important thing, this is important finding, but they cover their goal first, and then they added something else that they found interesting in the study. So the other one here, for example, 22 cancer patients, with the pre-existing autoimmune disease were reviewed, 15 patients were male. So they give you the characteristic of the patients, demographic information, and then they tell you, they give you some percentages, and they say what is the, people, what happened to their exacerbation. In 6 patients, there was the exacerbation was managed with systemic corticosteroids. 12 patients experienced resolution. So they mentioned some of the details related to the safety of the drug in these patients. So again, you look at all your results and see which one is worth to put in the abstract. And then, as we said earlier, title capture the attention of people to read, your abstract first. Then your abstract has to convince people to read the paper, the full paper. Do not try to leave, so put the most pertinent information in the abstract. Some people try to omit something very pertinent to see if the people will read the full. Don't do that. Just put everything you think, or the things that you feel most impactful. But most importantly, it has to be related to your objective that you stated. And the abstract has to be one piece of art connected to each other, going around one central idea that you set it in your aim of the project. Okay, so in the conclusion, when you put the conclusion, you need to provide the reader with brief take-home messages about the manuscript. So summary, interpretation, limitation. Sometimes you mention that based on how much words you have and what is the journal requirement, and what you try to what you're trying to convey to the readers. So when I read the examples, I will show you how, for example, quality improvement may have different sentences that you use in the conclusion and so on. So, but the bottom line, your conclusion has to be connected to the objective stated. Objective stated in earlier. I cannot overemphasize that. And I put it the red dot. That's your objective. Everything should take you in that direction that you stated earlier in the background. Okay. So if you look at the conclusions here, remote assessment with technology supported integrated behavioral healthcare were feasible at scale. Change in the symptoms could be observed at the individual and group level in real time, which may allow clinical teams to adjust the treatment and improve outcome. Prospective controlled studies. So now they said, it worked, but now they are giving you something to the future, and they're telling you that this is, when they give you something into the future, there will be an ideal way to prove this, to validate this, to have better, design of the study. So they're saying prospective controlled studies are needed to determine what factors contribute to reduction in symptom severity. So they say there is improvement, but they did not know which factor did contribute to the, and they say, okay, in order to understand this, we need prospective study to do that, and so on. The second conclusion, in a 6 months period, the project led to a timely administration of antibiotics for patients with febrile neutropenia in the ED. So they said, we achieved the goal. That's the conclusion. This improvement was sustained for more than 2 years after the project initiation. So in In the conclusion in quality improvement project, you should refer to, to a couple of concepts. Sustainability, was the project just, you did the success and then dead after that, or was sustained for longer period of time? And 2 years are usually the cutoff for sustainability. Or also, dissemination. Was this project spread to other units, other things? So you have to see what is the benefit, lasting benefits, and extension of benefit to others in the quality improvement. So, and the conclusion for the checkpoint inhibitors, although de novo immune-related adverse events and pre-existing autoimmune disease exacerbation were common, so it's really there. Most patients with the pre-existing autoimmune disease tolerated ICI, immune checkpoint inhibitor therapy, well. So they said, okay, yeah, there is exacerbation, but the bottom line, at the end of the day, they tolerated the treatment well. So they're assuring you that, okay, from what we looked at the safety profile, we look at the patients who receive it. Yes, there was exacerbation, but still, in the end of the day, they manage it well, and the patients handle it well, and so on. So that's the conclusion. And you can tell from each one of them, it gives you really, specific conclusion related to the study, and some of them then giving hints, the study objectives, and some of them giving you hints about what would be the best way to do the next step. Okay, so ready to submit. So now you have done the the whole component of the abstracts, and now ready to submit. We'll give you some reminder about ethics. Please do final checklist and so on. Always do the final checkout before you submit it. Read about author misconduct, fabrication of data, falsification, plagiarism, even self-plagiarism. Please be aware of that. If you publish something yourself in another journal, you may have lost the copyright of that. So you cannot use table you publish in another journal unless you read the agreement and who has the copyright of that. So that's self-plagiarism is called. Do not reveal patient's identity, please. So make sure that if you are having, sometimes people put an image and they forget to remove the medical records and the name or something. If you have in the study, you don't have room in the abstract, but in the study you have to mention that you got IRB approval. As we mentioned earlier, disclose all potential conflict and support. Do not include authors who do not meet the criteria of authorship. Again, if you have a third-party material, please take permission to use them. Let's talk about the critical factors, for publication. So they are looking, what editors and reviewers usually look for specific things: the importance, what the impact your research has on the practice, originality, is it innovative, new idea, or just me and another study after 100 similar studies. Relevance, will that be interested to your readers? Sometimes when you get a rejection from a journal, they may tell you this is not of interest to our readers. So they, people may get angry if they get rejected quickly, but actually the one who rejects you quickly may be doing you a favor, and just giving you a chance to go and apply and submit to another journal. So sometimes, because they tell you, our readers are basic scientists, they are not interested in clinical thing, so you have to make sure that you look at that anyway before you submit, and that from not just by reading the scope of the journal or the scope of the meeting if you're submitting, but you also look at the previous articles and so on. one of the best thing to, when you are considering journal, is to look at your references that you use. And, I mean, you are picking up topics or references from journal that publish material related to your article. Ethical concern, we mentioned it about it, then methodology, how, the methods sound and so on. Do not overinflate your conclusion and interpretation of data. Make sure that and do not mention in the discussion or in the conclusion things you do not have a proof for it in the body, the text. It has to be clear. You need to write to please the readers, not the reviewers or the editors. So if you write it in a clear way that the reader will be understanding it, so don't try to be too fancy and too putting too much big words and so on. That does not serve a purpose. And they searched 50 JAMA reviewers and 67 editors in 95, and they say, why you are rejecting articles? And the poor writing and excessive jargon is what was one of the top reasons. And then inappropriate presentation, inadequate, poor study design, poor design, poor description of the design. Actually, maybe the design is good, but the way it was described, not good. Excessive zeal and self-promotion, bragging too much or exaggerating their result and the meaning of the result, and so on. So I mean, this is actually the material. I just have to tell you about the call for abstracts. And this is actually the workshop is trying to encourage more people to write abstracts, and we have 3 types of abstracts coming in the pipeline. So one of them is for pharmacoeconomics forum, international pharmacoeconomic forums, and the deadline is August 1st. And the other one is, coming soon, actually May 31st, is Advancing Healthcare Innovation Summit. You can find at ahisummit.com the instruction for that. And then innovations in surgery and intervention medicine, the deadline is August 15. And this is ISI MENA. So the meeting will be, all of these have meetings related to it. So this one, the meeting will be in Saudi, and there will be virtual component on November 15. This one will be, the summit will be in August 27, as I mentioned, in Cincinnati, and virtual for presenters. And then this will be in Riyadh, Saudi Arabia, in December 8, 9. So these are abstract, that we call for abstract that you could submit if you are interested in any of the area. And finally, these are resources, and services for authors, so you can visit our website at innovationjournal.com and find the content and instruction to the authors and contents for the 4 journals. Visit ahisummit.com to look for a specific call for abstract for this meeting. The institute is innovativehci.com. And by the way, the journals has an agreement with Editage, which is, many major journals have that. Basically there's author service. They can assist in abstract writing, creating posters, language editing, art preparation, and more. So you can use that service through the journals if you like. And by this, I would be, just finalizing this, saying that you should be proud of what you have achieved, even if it's not accepted for publication in a particular journal or in a particular meeting. Just be proud of what you have done. Try to learn from what feedback you get from the editors, and try to submit to another meeting or another journal. And happy publishing.